Okay, thank you, Sensei Norio, and also Associate Professor Sunita. Dear ladies and gentlemen, before of all, I'd like to thank to School of Public Health, Kyoto University, for giving this great opportunity for me to present. Actually, this is just only the baseline data of my dissertation from the whole of dissertation. So, entitled Related Factors of Quality of Life Among Indonesian in Nursing Homes. Ladies and gentlemen, as we know that the population are getting older right now, UN data reported that in 2017, the aging population is just around 1 billion of total population. However, in 2050, it will be twice, around 2.1 billion. It means that in 2050, the more than 1 in 5 people will be 60 years or older. How about in Indonesia? Indonesia also facing this kind of problem. In 2015, we just had less than 10% of elderly population. However, in 2050, it is projected will be 10 to 19%. This is due to the increasing of life expectancy and decline of the birth rate. And this particular condition places Indonesia as the largest elderly population worldwide. And as the consequences from the growing number of these older people, is the old age dependency ratio could be increased as well as the national burden. Well, Yogyakarta province has considered as the highest of the elderly population compared to the other provinces in Indonesia. And Jogja also has the highest of life expectancy rate compared to the other 34 provinces and even the national number. Interestingly, Jogja has the highest in terms of the old age dependency ratio. The quality of life among elderly has become a concern public health, concern issue because it reflects their health status and well-being. There are so many factors that may influence the quality of life. However, lack of nursing home-based studies on quality of life and the related factors conducted in Indonesia. So that's why my study aimed to assess the level of quality of life and to determine the related factors among elderly nursing home residents in Yogyakarta province. So I have 10 independent variables here. The first one is gender, age, marital status, educational level, type of support, social support resources, chronic disease, length of stay, reason for living in nursing home, and perceived adequacy of care. And then the outcome will be quality of life. Well, this cross-sectional study was conducted in 3 districts in Yogyakarta province. The first district is Sleman, the second one is Yogyakarta itself, and the third one is Bantul district. This kind of the picture of the location through the small alley, and then here really close with the nursing home. One of the nursing home is the psychiatric hospital, and this kind of the map in one of the nursing homes. So in one nursing home, they usually consist of like 10 to 12 houses, and in one house they have like 10 to 15 elderly inside. It's kind of the picture of house in one of the nursing home, and then I took this picture. It's just like in the public area in the nursing homes. They place like medicine box here. They put like povidone iodine, and then bandage, and then like body lotion, quite messy, and then even like chalk for killing the ant here. And they place the wheelchairs at the corner of the building usually. Some of them are broken already, and then the remaining one is still okay. In terms of the inclusion and exclusion criteria, For the inclusion, I recruited the elderly who had to be 60 or older, and then had no chronic diseases, and then have been living there for at least 1 month. And then for exclusion, I exclude for those who have severe cognitive impairment or dementia, experience psychotic disorders, experiencing of alcohol or drug use, under antidepressant medication treatment, will not be able to communicate meaningfully and unwilling to participate. So, from the 3 nursing homes in 3 districts, I asked their participation for those for all of the population 273, and then I got the eligible participant 218. Then, due to the some exclusion criteria here, finally I found 181 respondents. This instrument divided into 2 parts. The first part is about socio-demographics, and the part 2 is about quality of life. For measuring the quality of life, I use WHO KL Breath Indonesian percent, which consists of 4 domains: physical health, psychological, social relationship, and environment. And then after getting the quality of life scores, then I categorized into 3 levels: poor, fair, and good, based on the main NSD scores. So for the result, here we can see that majority of respondents were in range of age 70 to 79 years, and then were female mostly. With the status, with the marital status, were widow, and they had no formal education. About 33% of respondents have been living there for 3 to 5 years. They still receive social support resources from their family. With the kind of support was psychologically. However, mostly they had 1 to 2 chronic diseases. And about 30% of respondents live in nursing home due to there is no support income, so poverty issue. About the perceived adequacy of care, more than half of respondents perceive inadequacy of care. In terms of the quality of life, there we can see that psychological domains has the lowest QL mean scores compared to the other 4 domains. And then social relationship domain has the highest of QL mean scores. Overall, majority of respondents had the fair level of QL. However, about 17% of respondents still had poor level of QL. Following this univariate analysis, the quality of life was significantly low among those who live in nursing home due to compulsion, and then had more than 3 chronic disease. They didn't have any kind of support. And with no social support resources. And another one is they perceive inadequacy of care. From this linear regression, I found that finally reason for living in nursing home and perceived adequacy of care remained the significant predictors for QL among elderly nursing home residents. So, as I explained earlier, the quality of life mean score was found to be 47.7. Another study in India with the same instrument using the quality of life, WHO quality of life, WHO QL breath, but in different setting. They took the community dwelling setting. They found that they had higher of the QL mean scores. In our study in Italy, they found that the QL mean score was much higher compared to my study with the same study setting. So this different finding of mean scores in quality of life may be due to different of observed associated factors, which influence the quality of life in different settings. And also, the different instrumentals may be responsible for this variation in results. So, the reason for living in nursing home as one of the associated factors for quality of life, since mostly the elderly nursing home residents live in nursing home due to compulsions. For example, some reasons such as the poverty, living alone at home and then no one taking care of them, and then homelessness, living as beggars. So the government through the municipal public other agency pick them up from the road because they are classified into neglected. The national census in Indonesia state that about 12% of elderly also living alone, and then around 5% of them, especially in Yogyakarta, being neglected. So this kind of forced condition might affect their psychological domain and then influence their quality of life. Perceived adequacy of care was also found as the associated factors. As we noticed that more than half of respondents in my study perceived inadequacy of care from the nursing home staff, especially, particularly from the nursing home social and healthcare workers that should be responsible, for taking care of the elderly in the nursing home. And then, as we know that in the geriatric population, most of the diseases are chronic. So, the healthcare workers should be paid attention psychologically and give the social support toward this particular vulnerable population. And then, furthermore, once the elderly are admitted to the nursing home, their interaction to the family and then to the surrounding people will be very limited. So this kind of sudden change of the environmental situations also lead to the stressful condition for this elderly. As the conclusion, perceived adequacy of care and reason for living in nursing home were highlighted as predictors of quality of life among elderly nursing home residents in the study site. And then, as the recommendation, improving the adequate healthcare services and developing the treatment strategies to enforce the adaptation process are urgently required in order to maintain their quality of life. And regarding the contribution of my study, my contribution of mine in this study, actually, this is, as I say, that this is just baseline data of the whole of my dissertation. Actually, my big project is about how to decrease, I assess the depression and quality of life, and then I did the initial assessment. Then I found that 10 of 37 respondents, excluded respondents, had the psychotic disorders. Then I lobbied to the key person in the nursing homes, and then they made a meeting. Then finally, I recommend to refer the psychotic disorders patients to the proper place. Then finally, or at least refer to the psychiatrist to get a proper treatment. And finally, they move to the rehabilitation center. And this is my project, the whole of my project actually. I assessed the depression and then the quality of life among this population. And then I found that the depression level of elderly nursing home residents is quite high, relatively high. And then the quality of life had fair level of QOL, and even they had some of them had like a poor level of health. So I tried to decrease the depression level and then increase their quality of life through some interventions. Since Indonesia is the biggest of the Muslim population in the world, so I tried to giving religious approach in terms of Islamic approach in order to reduce their depression and then increase their quality of life, especially by using the Quranic recital and then by the religious leaders. In the end, I hope that they will get a better quality of life. And actually, I had finished my dissertation, and then the result is significantly different. I did a repeated measurement. So I employed for 3 months intervention, and then a repeated measurement, and they had a significantly decrease in terms of depression and increase of the quality of life between control and intervention group. So thank you for LPDP for funding my research, and arigatou gozaimasu.